If I get this in my right hand.
Noreen Smith is trying to perform a task most of us take for granted.
I just can't. I can't control it.
Smith is among the 3% of Canadians who suffer from a nervous system disorder called essential tremor. It causes uncontrollable shaking, most often in a person's hand. Essential tremor won't shorten her life, but it definitely affects her quality of life.
We're invited out to dinner, and I won't go because I'm embarrassed dropping food. And the butterflies.
So when the Smiths heard Noreen was a candidate for a medical procedure called MRI guided focus ultrasound, they were thrilled. It's a procedure that doctors say will revolutionize the way brain disease is treated.
It is a game changer. No scalpel needed, no drill needed.
At Toronto's Sunnybrook Hospital last week, doctors prepped Noreen for the procedure. Her head shaved, metallic headgear screwed into her skull.
Run in now, okay?
Placed inside the MRI, Smith is alert throughout the 4-hour procedure. The surgery allows doctors to focus ultrasound waves guided by an MRI through a patient's skull, deep into the brain to the area that causes the tremors.
What we're effectively doing with this procedure in a non-invasive way is killing those neurons and destroying those neurons with high-frequency focused ultrasound.
Dr. Lipsman is part of an international team that studied 76 patients with essential tremor in a clinical trial in 2013. After 3 months of treatment, tremors in patients who received focused ultrasound improved by 47%. That's compared to less than 1% improvement in those who received a so-called sham procedure or placebo. Remember that glass of water back in Noreen's home?
This is half full of water, okay? Let's try to take a sip of that.
This is amazing.
Following her procedure, she performed a few tests for doctors.
Go back and forth.
Just being able to hold my hand like that is miraculous.
Her handwriting before the procedure is nothing but scribbles. Afterwards, she's able to write her name effortlessly. Doctors hope to apply the technology in the treatment of other diseases like Parkinson's and epilepsy. Noreen Smith has a more personal goal.
I'm going to be able to sign my husband's card for our 50th anniversary.
They'll mark that milestone later this year.
You did really well. Really well.
Yes, buddy.
Cass Rusi, CBC News, Toronto.